that healthcare is a right and not a privilege since the second to last time the Cubs won the World Series.
Affordable healthcare is such a debated topic. The U.S., according to this graph, has the most expensive healthcare system compared to all these countries. Mr. Salami talks about this.
Care should be affordable because it is a basic necessity for every individual living in the United States. The United States is one of the leading countries in the world, one of the richest countries. Other countries that are less, capable of providing to their people have a free health care, and everyone is covered with health care.
To look further otherwise backwards to the 1960s, a very mixed era, President Lyndon B. Johnson at the time first introduced two healthcare systems. First, Medicare, which is healthcare for the elderly, and Medicaid, a healthcare for those with limited income. If we look at this pie graph, we can see that Medicare is only 15% of the federal budget, Medicaid is only 10%. Now let's move to the early 70s with, of course, Queen. President Richard Nixon proposed employer-based health insurance, but as we all know, Watergate held that thought. In the late 70s, Jimmy Carter worked with Congress on making many healthcare reform ideas, but they didn't work. In the 90s, Bill Clinton had a healthcare reform plan, which ensured healthcare for every citizen, but it died in Congress. Finally, in 2010, President Obama formed the Affordable Health Care Act, which gave U.S. citizens affordable health care. It still stands, but there's a catch. The first poll shows how many people who favor the Affordable Health Care Act. Same with the second and the amount of people against replacing it. Dr. Kronfeld said that it was because of ignorance that these Americans don't want it. Over time, with how divided our government has become, it's no surprise that the Affordable Health Care Act is slowly deteriorating. Affordable health care seems to be an amazing concept, but some of the nation plainly disagrees. They're against how easy it would become to receive the affordable health care, like you have to work hard for it. But it seems that the nation already works hard enough to not even gain that much. The Affordable Health Care Act might stand, but people keep trying to knock it down repeatedly. These Americans want their rights, and healthcare should be a given right. These people keep protesting, and you can probably guess it, protesting. But why? Why are these Americans fighting for something that they already have? Well, conservatives and the Republican Party have repeatedly tried to knock it down. People, mainly bigger health corporations, don't want healthcare to be affordable. It's what makes them the money. The government revolves over money than caring about their own people. And surprisingly, since the Affordable Health Care Act has been established, there has been nearly 2,000 legal cases against it. The outrageous healthcare system divides people to travel outside of the U.S. for procedures that would be costly here. Looking at this graph, there are the reasons that people travel outside the U.S. for procedures. The top is effectiveness, followed by cost. This leads me to begin to wonder, if the U.S. is giving less effective treatment, then why are they charging more? The answer is because they want money. For example, the price difference between the U.S. and Colombia. Americans should have access to affordable healthcare, and someone shouldn't have to die just because they can't afford treatment. Obama's Affordable Health Care Act was a very important change that benefited many Americans. And although the Affordable Care Act has endured many years, America's healthcare can still improve. If a top country has to think twice before giving their citizens affordable healthcare that they can afford, then hope in humanity is lost.
After multiple challenges to this law before the Supreme Court, the Affordable Care Act is here to stay. This morning, the court upheld a critical part of this law, the part that's made it easier for Americans to afford health insurance regardless of where you live. If the partisan challenge to this law had succeeded, millions of Americans would have had thousands of dollars worth of tax credits taken